All right, welcome everyone. I think we will get started with today's session as folks continue to join us. But thank you so much to all of you that are joining. This is the first of a webinar series that is sponsored by the Cholangiocarcinoma Foundation and has been developed by the Next Generation Committee, which focuses on developing mentoring programming for young investigators with an interest in cholangiocarcinoma. And we are really honored to kick off this webinar series with the talk from Dr. Lipika Goyal on how to give an academic talk. She has given countless numbers of really amazing academic talks. I've had the pleasure of seeing many of them. So she immediately came to mind when we thought of this topic. And so we're excited to have her here today. This is meant to be an interactive session, and she will guide us through that with some question and answers. So we'd love to, if you don't mind, have your cameras on if you're able to, and please actively participate. Dr. Nilo Azad is my co-chair. I'm Dr. Kristen Spencer at NYU. And Dr. Azad, do you have anything to add before we turn it over to Dr. Goyal?
No, not at all. I just want to thank Dr. Goyal for being our kickoff session speaker, and this is a real pleasure to be able to have her present to you guys.
Wonderful. All right, without further ado, Dr. Goyal, we'll turn it over to you.
Thank you. Thank you very much to CCF for inviting me to talk. I thought the way I would do this was, let me share my slides maybe to start with. Okay. Um, the way I would do this would be to give a bad talk first, very briefly, and then ask people sort of why it's not the most effective way to communicate and see what we can do in terms of the way we communicate and the way we do slides. I was thinking maybe there would be a lot of fellows and like maybe junior faculty on the webinar. So I think some people on the call have already given really great talks. So let's work together and see what we can come up with. So I'll start by talking about Jerry Seinfeld. So I went to see Jerry Seinfeld give a comedy show about 3 months ago. And I was reading a little bit about Jerry Seinfeld online, and it said that Jerry Seinfeld practices the way he delivers his comedy routines down to when he's going to turn on stage. And the reason I say that is that preparing for talks goes a really long way in having them seem very polished. So, like every intonation in his joke, every time he's going to move the microphone to a different hand, it's all very planned for Jerry Seinfeld. So, there's very much like a magic to the way he does things. And I would say that when I am giving a talk, you either win or lose people on your first like 30 seconds of speaking. And so being able to practice that really well goes a long way. So as I mentioned, I'm going to start by giving a short bad talk, ask you why it's a bad talk. Then we'll give a good talk and ask why it's a good talk, and then summarize 10 tips for giving a good talk. So FGFR inhibitors in cholangiocarcinoma is what I'm going to talk about. Here's the FGFR inhibitor signaling cascade. FGFR inhibitors are a class of different receptors that are tyrosine kinases. There's FGFR 1 through 4, blah, blah, blah. I'll skip the content, but here's a little bit of information about FGFR. FGFR is one of the alterations in biliary tract cancers, which are an uncommon cancer. They occur in less than 1% of new cases globally. They're aggressive malignancies, and surgery is the mainstay of cure. When you give chemotherapy, people live a median of about 1 year, and it's molecularly heterogeneous, as you can see in the different subtypes. There's lots of different new targets that we can use, that we have drugs against. For FGFR inhibitors, there are 2 drugs that have been FDA approved, pemigatinib and futibatinib. You can see they're slightly different in that Pemi is a non-covalently binding inhibitor, futibatinib is a covalently binding inhibitor. These registrational trials that led to their FDA approval had similar populations. Futibatinib was intrahepatic only, pemigatinib was extra and intrahepatic, although majority of the patients in that trial were intrahepatic. You can see the response rates are comparable, 36% and 42%. The median duration of response was 9.1 with Pemi and 9.7 with Futi. And then you can see the other numbers are also comparable, with the median PFS potentially being a little bit longer with the futibatinib drug. These drugs have a bunch of side effects. As you can see here, people can get high phosphorus, they can get some hair loss, they can have some dry eyes, and there are a whole bunch of next generation inhibitors. One of them is RLY 4008. Here's some information about the drug. We can pretend that I went into some of the details about the drug. Here's another drug, tiningatinib, also making a splash, another next generation inhibitor. These are people who previously got an FGFR inhibitor, and you can see they're getting response, so that's exciting. And then here are a couple more FGFR inhibitors. So right there, I will just stop right there for a moment. What are some reasons why this was not the best talk, or what are some things I could have done better?
Can we just answer without?
Yeah,
Yeah.
I think it's more
Okay.
fun than
Yeah,
for us to
chime
kind of go
in.
back and forth than for me to
Honestly, then. Okay. Okay.
go
Well,
slide by slide.
yeah, then speaking was very quickly, very monotone. You didn't look at the camera or the audience. The slides were really filled, packed too much. Quick changes through the slides sometimes. And yeah, you didn't explain the plots. Like, I mean, you know them, but people don't. Yeah.
Yes. Those are all really excellent points, Skada. Thank you. Anyone else?
Let's see, we have Neil and Allison and Valerie and a second Allison. So the Allisons can be anonymous, but
Yeah, well, Gada, I think you hit on a lot of the key points. I'll just share things that I sometimes see when I see talks and things that I did when I was a junior faculty that I'm like learning to do over time. I always try on the first slide of my talk to, one, have a title that's a little bit enticing that people are excited to listen to. And two, I always try to put the name of the conference that I'm speaking at. I always try to put their logo, and we often put our own institution's logo. So for a front page, let's see. Oh, sorry, I scrolled all the way back. I do something like this, where you have some information about yourself, you have the title, you pay homage to the Cholangiocarcinoma Foundation or whatever conference you're speaking at. And then when I jumped in, remember I just jumped in on a slide of the FGFR receptor. I think that's not so exciting to jump in and just say, here's some information about the receptor. I think how you start is really important. And so something I did when I was a fellow is, and even sometimes what I do now, I just practice the first minute of my talk many times so that I really feel like I can engage the audience, that there's not a lot of ums and ahs, and it's some sort of story. So people who have seen me speak have seen me do this presentation before, which is I'll talk about how cholangiocarcinoma back in 2010 when I was a fellow, there weren't a lot of birds on the wire, there weren't a lot of people studying it, and then now there are a lot more. And then I talk about how clinicaltrials.gov, if it's any indication, there's a lot more enthusiasm about it. Another way I sometimes start is I give context about something that is about biliary cancer in the context of other diseases, because I think it's always helpful to teach people something when you're giving a talk. So maybe everyone in the room is like a biliary tract cancer expert, but maybe they don't know about all the FDA approvals in 2024, or they don't know about what's going on in other cancers. So something where you can put the information you're giving to people in context with other new information. People always like to feel like they've learned something when they've walked away from your talk. The other thing I sometimes do is, as part of framework, I will talk about whatever I'm talking about on a timeline. I think timelines are really great because they really show people what the arc is of the development of whatever you're talking about. So I've seen a lot of people do this over time. They kind of give the historical perspective. When people talk about KRAS inhibitors, they'll talk about like when KRAS was identified as a target and what's happened over time. People, when they're giving immunotherapy talks, they'll talk about the first immunotherapy that was developed. So something like this, and then I highlight where on the timeline the talk is going to talk about. You know, if you want to talk a little bit about biliary tract cancers, that's okay. You know, the way I said it was, now there are a lot of new targets, right? Being able to do that visually whenever you're trying to make a point always goes a long way. One of the other things you might have noticed on my previous slides was I didn't have the attributions for all the different figures, for all the different data. That's something that I also see some new people when they give talks, that the source of their information is not always there. I think that's really important in academic talks, that we always have like the source of the information, some citations, so that people know exactly where the data is coming from. But as much as possible, having pictures on your slides as opposed to having a lot of words. I mean, we all know that, you know, but it really goes a long way in terms of aids. And as Gada said, there were just too many words on some of the slides. This is another slide that I've seen some people start pancreas cancer talks with, which is like somewhere where the audience can really connect to what you're trying to say. People start with, you know, here are all the faces of pancreatic cancer. Do people have other ideas or tricks when they start talks? The way I think about it is, you either share a fact that is new, interesting, engaging, or you share a story. Those are the two different ways that I generally tend to start talks. Anyone have any other tips on things they think about when they're starting talks, how they think about starting talks?
So
Go ahead.
I just want to say that, you know, one of the things Dr. Goyal mentioned, and is something I'm excited when she's going to do her good talk, because you're going to see it in just a couple of seconds. But it's really that kind of engaging energy. A lot of the slides, like I was actually taken by the slides being so common. Like these are the kinds of slides in just the cadence that you showed them. And I think that like there's ways that you can have exactly the same slides and have enthusiasm and energy and just highlight a couple of things on those slides and talk through the rest of it. And that is something that Dr. Goyal does very well, and I think is like one of the things that really helps with prep when you prep a talk, because you don't want to read what's on there. You want to kind of come at it with enthusiasm, and that makes a huge difference.
Yeah, that's a great point. Thank you, Nilo.
Lipika, just gonna say, oh, yep, go ahead. Got it. No, you over me. We want you guys over. They don't want to
Sorry.
hear what I have to say.
I don't know, sometimes I start with a joke in my talks, and it can
Yeah,
help.
that's a great thought too. A joke, a factoid, or a story. I love that, Gada. Neil, you were going to say something. I think you're on mute though. I think you're on mute.
Yeah, hi,
Nothing
it's
new.
Neil. And one thing I would say, I've given, I'm a former PA in primary care. I've given a talk or two, and I've listened to a lot of presentations. One thing I would say is one of my complaints about presentations, especially from a patient perspective, is how much they can be above the head of the listener. And I think especially starting off a presentation, you know, starting off really basically to allow things to build from there. But sometimes things, again, what the prior a person said, that, you know, and the other thing too is oftentimes that these presentations go so fast, the slide is up for like 2 seconds, and really in a lot of ways it's almost meaningless. But so that would be my couple of feedbacks.
Yeah, those are great points. The idea of building block by block the story. So the way I've heard it told is, start for like the medical student and, you know, for the patient, then go for the resident, then for the fellow, and then for the attending, in terms of build the knowledge, build the level of complexity over time, and have people follow along. So I'll just do this first slide the way I normally do it, to Nilo's point about having energy. So thank you to the Cholangiocarcinoma Foundation very much for inviting me to give this talk. You know, when I was giving drugs for patients with cholangiocarcinoma back 10, 15 years ago, all we had was chemotherapy. But now we have all these targeted therapies, and FGFR inhibitors are among the most effective drugs that we have. So I'm really excited to share what kinds of advances there are for this field. So back when I was a fellow, this is what the field of cholangiocarcinoma looked like. There was like 6 birds on a wire. There weren't a lot of people studying cholangiocarcinoma. And I remember when my mentor, Andrew Zhu, and I used to go to ASCO, we would be asking companies, can you please give us the drug that you're using in pancreatic cancer? Can we please use it for cholangiocarcinoma? And there weren't a lot of companies who were giving us a lot of attention. And now in 2025, there are a lot more birds flocking to the wire. There are a lot of pharma companies, a lot of scientists, a lot of clinicians who are interested in this disease. And now when we go to ASCO, we have to turn away being able to meet with companies because there's so many people who want to meet to talk about cholangiocarcinoma. And if clinicaltrials.gov is any indication of what it's like right now in the field, the number of trials that have been developed for patients with cholangiocarcinoma are so many more, and a lot of them are specific for cholangio. So big difference now compared to before. So that's one way that I'll sometimes start, and it's a way to sort of see what's the arc. And then here are some other ways I've started other talks. Okay, this is the slide that we had before about pemigatinib and futibatinib. The good thing about this slide is it offers a comparison, but it's a lot of words and maybe not the most effective way to absorb. So what I will sometimes do is I will anchor it against, this is where we are, this is FOLFOX, and then these are the other ones, right? So right now in the field of cholangiocarcinoma for second-line treatment, we have second-line chemotherapy, and that's FOLFOX. The response rate for that is 5%. Of course, that's not biomarker selected, but that's what we're trying to beat with all these targeted therapies. And you can see now with pemigatinib and futibatinib, the response rates are much higher. Pemigatinib is a reversible inhibitor, which means that it binds and it competes with ATP, and it binds and it comes off, and it binds and it comes off. Futibatinib, it's like a pit bull. It's an irreversible inhibitor. It just gloms on to the FGFR inhibitor, and it doesn't let go. If you remember from chemistry back in the day, it's a covalent bond, so it's very strong. And then, I would talk about the waterfall plots. So a little bit of a different approach because you're anchoring against something. So I always recommend that too, whenever you're sharing data, is can you anchor against whatever is in the field right now so you can show the improvement over time. Here's another example of anchoring. If you want to show context of biliary tract cancer compared to other cancers, this is another way to teach people something they may not know. So giving people kind of context that prostate, lung, colon, and breast are the most common cancers, and that liver and bile duct cancer are not even in the most common cancers, but mortality-wise, they're in the top 10 in the US. But this kind of teaches some people something that zooms out from cholangiocarcinoma itself. The other thing I wanted to talk about was titles of slides. For example, this is a slide where if people don't know what Topaz 1 is, they're not going to really have context for what this trial is about. And then this is one of my own pet peeves. People will just put a slide where they'll just write efficacy on the top. But when you're talking about the data for a particular trial, you wish that people are engaged the entire time when you're talking, but people's attention span goes in and out. They're thinking about, the dry cleaning they have to pick up at the end of the day. And so one thing I always recommend to people is that when you are giving slide titles, to really have them be informative. So someone who's like peripherally paying attention, or someone who's like trying to grasp what you're saying, from the title, they can fully appreciate what it is that you're about to talk about. And same thing with when you're talking about efficacy and PFS and all that kind of stuff. Give some context about what trial it is. And here you can even say Gemcis Durva overall survival, something like that, just so people really have context of what you're talking about in case they lose the thread. To anybody else, anything about titles of slides? Do you find that to be an issue at all when you hear people talk, or any tips on that about titles? Okay, just something that I find valuable when we're talking.
I think it's a good point, Lipika, because I think sometimes the titles are either too long or they're not descriptive in any way. And, I always like to start with, get the message right at the top, right?
Yes, exactly, exactly. You want people who are listening to your talk to immediately grasp what the point of the slide is. and not have to do too much mental gymnastics to try to be like, what's the message of what we're trying to say here? And then this is a slide on toxicities. So first, the title of this is like very clumsy, right? It's like FGFR signaling pathway inhibition related adverse events, or AEs. One, I try to minimize acronyms when I'm giving slides or when I'm giving talks, just because those acronyms might be common to you, but they may not be common to most other people. So unless they're like really common acronyms that everybody uses, and really minimize the use of acronyms in talks. So here's another example of how you can talk about toxicities. So here are the key toxicities of FGFR inhibitors. Overall, they're different than chemotherapy. They're an oral molecule that are a tyrosine kinase inhibitor. Some of the things that are unique to FGFR inhibitors are XYZ. Some of the things that are common to FGFR inhibitors with other TKIs are XYZ. In the interest of time, I will not go over all the content and everything. It's more just to make a point that these kinds of visuals make a big difference compared to being able to list things out. Same thing, these are really good visuals. Another slide from another, talk that I found really helpful, in that there's a great visual, and then it gives you frequencies of toxicities. And I think that's really helpful in the way we think about these. I think this is also a really helpful slide. It talks about the cadence and the time of onset of toxicities. So I think so often when we give talks and we're talking about symptoms, it's just a list of things. And I think being able to give context, flavor to any of this by giving frequencies, by giving time of onset, any of that teaches people something. And it also gives people a chance to zoom out and like understand these drugs more generally, right? So even if I'm giving a talk on toxicities of, atezo-bev, for example, in HCC, a slide like this, in addition to just the toxicities of atezo-bev, can give people a little bit more context. So I think so often when we're presenting clinical trials, they can be kind of bland, where we're just like, here's the efficacy data, here's the safety data, and you do it one trial after another. But if you can insert slides that are like this, or that are like this, that give people some context, of course, it depends on the audience and the reason you're giving the talk, but things like this, where you get to zoom out, really give people a lot of context. Any thoughts on that as people give talks in terms of giving context slides as opposed to just flat slides?
Lipika, one issue that I raised when I earlier was how fast slides come and go in presentations. And what are your thoughts on that?
Yeah, absolutely. So one of the things about slides like this, for example, I will often do a slide like this, and I'll spend 3 minutes on this slide, as opposed to having the same information over 6 slides. So that's a really good point, Neil, that sometimes when you give these types of talks, you can give the full Fox slide and you can use this. Then you can flip slides, and then you can talk about the schema for pemigatinib, and then on the next slide, go over the efficacy. And then you can do another set of slides, which is the schema for futibatinib, and then the efficacy. And you can do that over 6 slides, but you're flipping slides very quickly. So when I tend to give this talk, I'll do it as animations, and I will first talk about FOLFOX chemotherapy. Then this will come up, and I'll talk about pemigatinib. And then this will come up, and I'll talk about futibatinib. And so, Neil, I totally agree that being able to use animations to try to get more things on one slide sometimes, as opposed to flipping 6 slides, goes a long way. And one, being able for people to visualize all that information together on one slide. And 2, you get to spend more time and go more slowly on a slide, as opposed to trying to spend 30 seconds on each slide to give one message.
Thanks.
Yeah, that was like one of the key points of this slide. The other thing, when I gave the other talk, is I just went one molecule after another, right? I just said, here's futibatinib and pemigatinib. Then there's some next generation drugs. So here's tiningatinib, here's Relay, here's Cogent Tyra, right? But there was no storytelling as part of that. It was just a whole list of like 5 different types of drugs, you know? And we see that sometimes when people give talks, they just go one trial after another, right? They're just sharing information about different trials. But part of giving a talk is it's kind of like when you write a review article. You are a key opinion leader where you're trying to share your take on a field. You're trying to put things in context for people. So the glue slides are really important. And so to connect the FDA approved drugs to the next generation drugs, you want to share what is the problem that we were trying to solve, right? So here, giving some information about, well, those drugs are great, pemigatinib and futibatinib, they're the first drugs that I got FDA approved. But at some point, those drugs fail and patients' tumors start to grow. And why is that? Because they develop acquired resistance to these inhibitors. And then, you can go into explaining what acquired resistance is, and some sort of visual around that can be very helpful. And so the next generation of inhibitors, the goal of them is to overcome this kind of resistance. And then I'll talk about a couple of studies where there's been information using liquid biopsies, like how do you detect resistance, talk about some collaborations where, resistance was detected and all the different ways you can detect resistance and the different types of resistance. And then instead of just saying, here's tiningatinib, here's, the data for it, being able to explain to people why are these new drugs better than old drugs. So this talk about how to give good talks is partly about, when we give a lot of these talks around clinical trials and lots of drugs one after the other. But the key here is about telling the why, giving the glue, being able to tell a story as you go through slides as opposed to just one slide after another. Kristen or Juan or Nilo, any advice around storytelling with slides?
Yeah, so I mean, one of the things that you do really well, and one of the things that I tend to practice is also knowing the transition to the next slide. So I'm a very visual person, so like you, I use a lot of images, but I map out, for example, on this slide, I would map out where my train of flow would go, and then how it's going to connect to the next slide. Because also sometimes when you begin talking about the next slide and then it comes up, it also shows that you're comfortable with the topic, and that there is a story that you're telling, rather than the slide appears, there's a pause, you're thinking about what to say about that slide, and then you kick off. There's something around that smoothness.
That's exactly right. That's exactly right. So something like when you're on this slide to say, these drugs are great, but we're also seeing that the duration of response for these drugs is only 7 to 9 months. And so why is that? And then you ask a question or you do something that opens up your next slide, which for example could be about resistance. So I think that's a really key point about heralding what you're going to talk about.
I can't see Lipika's slides if you're sharing them anywhere. Is anyone else having that problem, or is it just me?
I can see them.
Oh,
Yeah.
uh-oh. All right, ignore me.
I can see them too, and I actually have a quick question. What do y'all think about animations on slides, like to go along with the point you're making, like whether that is something appearing on a slide as you bring up the point, or maybe like using, an arrow or a circle or something?
I think animations can be super helpful. It's just honestly one of the things that is best to practice as well, because sometimes, like when you're up there, I get invigorated by being on stage, but then sometimes you're kind of going and then you kind of forget that you're talking kind of, you either talk over it or, then the animation comes up and you kind of had like a mental brain moment. And so I think they can be very effective. It's just a nice thing to kind of make sure you've got that cadence down.
Yeah, I agree with Nilo, Valerie. I think it's a great question. I use a lot of animations when I talk. Partly, for example, this slide usually is animated and I do it as like one panel, second panel, third panel, to be able to bring up comparative data and to be able to spend more time on one slide. And I also do a lot of what you just said, which is like put an arrow somewhere or draw a box around something. So in a very busy slide, you say, and this is where I want to draw your attention, and this is what I want to focus on. So for example, when you're bringing up symptoms, for example, if you're giving a talk about the adverse events of a drug, if you want to highlight something, you can put a big red box around those. So yeah, I think using those learning aids are super helpful.
Just one thing to add, if I may. If you're going to use animations, I would very strongly suggest that you check it's working when you get to your destination in the speaker ready room. Because these things do not always get transported electronically correctly, and sometimes, especially if you're using Mac to a PC, it can sometimes corrupt some of the animations. So just make sure you practice it in the final venue.
Gotcha.
That's a great point, Juan. The other thing that I've noticed sometimes is when you upload your slides, the formatting gets messed up and things end up getting shifted. I've had that happen one or two times at like ASCO or ACR because I didn't like check every single slide before I went on. So definitely checking the formatting when you're going up before a big audience also makes a big difference.
Okay, gotcha. So it's like a tool, but make sure you practice it, and yeah, just be careful with it, I guess.
Yeah, yeah. One more thing that I think is really great to do is to amplify others in your talk. So if you're like working with collaborators, if you're working with junior people, if you're working with, whoever your team is, I think it's always great to be able to, put up the picture of any fellows or junior faculty that you're working with. If you have a lot of collaborators, being able to, highlight them. It goes a long way to be able to acknowledge all the work people are doing together with you to make this happen. And it also just shows to the field how much collaboration is going on in the field. I've seen a lot of people do this very well. Here is another way that you can, it's another example of how you can teach people something. This is like the current approach that we use for translational research and historical approach, and this is the approach we need. Adding some sort of inspiration in your talks about like the direction you want to go in, I think that also goes a long way in terms of like, this is where we are right now, and this is the direction we want to go in. Here's a classic example of the formatting. I didn't hide the background on this slide. This is from a slide that I used from before. But some sort of inspiration about and some sort of aspiration for the field. I've seen Nilo and Juan and Kristen all do this, where you're saying, this is where we're trying to get to. I think leaving people with this or starting with something like this also goes a long way because you want to inspire people. On people's acknowledgement slides, I think putting your granting agencies is a really great thing to do. I see a lot of people thank their labs and their collaborators, which is great. And I also see a lot of people thank their granting agencies. And I think that's really important to highlight, Cholangiocarcinoma Foundation, American Cancer Society, NIH, whoever it is that's funding you. One, it's also an advertisement for them, so people know that these agencies are providing funding for whatever kinds of research that you're doing, but also it's a nice way to pay homage to people. And so overall, here are sort of like some of the tips that we went over today. Practice your first 2 minutes. I will rehearse this and rehearse this and rehearse this and just make sure that I have it in a way that's very storytelling, very smooth. Offer a roadmap. That was the other thing I didn't do in the bad talk. In the interest of time, I didn't do it so much in the good talk, but at the beginning of this talk, I put a little slide about this is what I'm going to do. What I normally do in my talks is I'll make like the 3 bullet points that I'm going to be talking about, and then each section as I go through the talk, I will keep putting that slide up, and I'll put a little square around, okay, now I'm on this section, now I'm on this section. And it just gives people sort of an anchor of where you're talking. Using clear titles like we talked about, teaching people something new, and that's often zooming out a little bit and putting whatever you're talking into context. Neil, as he said, build a story 1 block at a time so people can follow you. As Valerie brought up, using animations very effectively can be helpful. As Juan brought up, using graphics and fewer words on slides, making sure we amplify people that we're working with. And then the take-home slide. One thing on the take-home slide is sometimes we tend to summarize alone on take-home slides. And I think one more thing to do on take-home slides is make people think. I see Katie Kelly do this remarkably well all the time, where she'll summarize what she talked about, but then she'll also talk about future directions. I think that's really helpful to kind of get people thinking about what are the new studies we need, what are the hypotheses that we're developing that need to be validated. And then lastly, I would just say finish on time. Your talk just looks a lot more polished if you're starting on time and you're finishing on time. As Gutta said in my first talk, I just rushed through a lot of things. If you're rushing towards the end to finish on time, it just doesn't look as good. So those are just some of the key points that I think about when giving talks, and open to anyone else's suggestions.
Any thoughts, comments from anyone? Nilo, Juan, you're big. Yep, go ahead, Juan.
Yeah, I really like the idea. When you see industry sponsored studies, presenting at industry symposia, you see that they also include the definition of all the acronyms along the bottom. And I think having a standard place where you put your references, but also a separate place where you put any acronyms, SCAT, for example, some of us know what that is, but it's not easy for others to know. And sometimes when you're trying to read it out, you kind of forget what it is. It can help you as well as a reminder, but always having acronyms in the same place of slides can be very useful.
It's a great point, Juan.
One thing I would add would be effectively speaking to your audience. And for example, like the Cholangiocarcinoma Foundation presentations, I'm there primarily as a patient, and I do find a lot of them go over my head. And I just look around the room and I think to myself, it's got to be going over so many other people's heads. I know the foundation is a grouping of all different disciplines, including researchers and scientists. But I'm kind of wondering, how do you balance that challenge of not going over patients' heads in scenarios like that? I think your talk is geared more towards academic presentations, but I think that's a really important scenario as well.
I have some thoughts. I don't know, Juan, if you want to answer that from the foundation perspective.
Yeah, thank you, Neil. I think the key point that you're making is know your audience. And to be honest, it's not just a case of having a lay audience and a scientific audience. If, for example, we're giving an academic talk to a room full of surgeons, then you have to pitch it completely differently, because they won't understand necessarily the nuances around, what you're talking in terms of drugs and signaling pathways and resistance and so on. So I think the key thing there is about knowing your audience. I think in terms of making things happen, that can be a bit more challenging. So, we do give a steer to people who are going to speak at the foundation, so that they know that a lot of the audience is going to be, patients and caregivers, and maybe having, a part of the slide of kind of what this means in lay terms, or even starting off, as Dr. Goyal said, starting off with something basic and then building would then allow people to accept that they can understand so much. There are other things that maybe scientists and clinicians will get value from, but at least within that slide, there is also some value for people who are not of that background.
Yeah, I think, Neil, it's such a good point. And whenever I'm asked to speak, if it's not like a usual like ASCO AACR type talk, it's a question I always ask the person who is asking me to speak. Like, if we're doing CME talks, I always say, so who's the audience for the continuing medical education talk? Is it doctors? Is it nurses? Is it pharmacists? Is it people that treat cholangiocarcinoma? Or is it general community oncologists? Like, who's the audience, so that you make sure you pitch it at the right level for that audience? I think it's a really important point.
Any other thoughts or questions while we have Dr. Goyal, while we have her attention?
Nilo, I saw you come off mute.
Yeah, I
Any
mean,
extra tips for
I
putting
just,
it together?
I'm a horrible procrastinator, and I think I'm like, I was like, I'm not going to say famous, but I was like, I always show up and change my slides the day of a talk. Like, I always am the one who's like, hey, can we change out the slides? But it's because before I give a talk, I give it start to finish at least once, often like a million times, but sometimes at least once. And what you end up finding is when you're talking through it in your head and even saying it to your head, versus when you actually speak it, you realize the slide orders should be a little different. You've left a little something out. Maybe the animation would be helpful to make your point. And so I would say just, when you're doing a talk, even if it's an old talk, make sure that you give the talk start to finish and that you block off time in your schedule to do that at least one time to make sure that you're going in the right, that you don't need to make some small changes that can make a really big difference and not trip you up while you're talking,
I think that's a great point, Nilo, and I think it also helps with Juan's point around being able to herald the next topic. So if you've been able to practice your talk once, you have a sense of what slides are coming next, and it allows you to herald them, and I think that goes a long way. So yes, I totally agree with practicing once, or twice, or 6 times.
The other thing, just to quickly add, and Lipika, you do this very well. There are others who do this very well also. Is I try to do it. Is to be aware of what other talks are happening within either the conference or the meetings, so that you can also signpost to those presentations. It shows that you're involved not just in giving your presentation, but you're involved in the whole meeting. So if I'm talking about new developments in drugs in cholangiocarcinoma, then signal to the fact there's going to be a presentation on FGFR inhibitors by Dr. Goyal, so that you can just signpost that. It shows that you're collaborative, you're working within that community.
Can I jump in at one thing that brings up too? One, like, the times where I have really regretted not prepping has been when I'm part of a group of people speaking and I didn't talk to the other people before to figure out what was going to be on their slides. And then I'm sitting there and they've already presented half my slide deck and I'm presenting after them and I'm like, oh crap, they already presented all of this. And so if you're part of a panel of talks, always try to reach out to those folks before. And honestly, if you can do your slides first, then you get to, like, I mean, that's the other piece. Like, that can motivate you to not procrastinate as much, because then you've done your talk and then then they know what you're going to present and they can modify what they're going to do around that. So definitely those have been times where I definitely have kicked myself and been like, oh, like should have planned better here,
Yeah, definitely. I want to echo that, because sometimes, when you're organizing a panel session, you give all the speakers titles, but like the way speakers understand those titles might be a little bit different. Or maybe whoever planned the session, maybe they weren't really thinking about what the kind of overlap there might be between the talks. So it really goes a long way, as Neil was saying, because you want to make the conference look good. You want the audience to really have a good experience coming to that conference. And so if you can figure that out with your panel ahead of time, like talk to the chair of the panel, talk to the other people, and like divide and conquer about, like, okay, you talk about this, we talk about this, I think it overall goes a long way for polish.
But then I think that what we are saying here is that even though we said in the beginning that we should practice a lot, we should know our slides so much and practice a lot and knowing them by heart, but still we have to be very flexible and to kind of like be spontaneous a little bit, which I do a lot in my presentations. So sometimes it pays off. just like some things happen, or some in the conference, or maybe just things that happen to you, and sometimes just including them and being very spontaneous in the talk can make you more comfortable and can make you more relatable to the audience.
I think that's a great point, is like not being rigid in your thinking and being able to be like, oh, if someone already spoke about a couple slides, you don't have to repeat all those slides. Or if you heard someone, talk about something that's related to your topic, even giving that a shout out and being like, as Dr. Vale mentioned earlier in the conference, XYZ, it kind of brings it back and shows that you're paying attention, that you're engaged in the conference, as Juan is saying.
I'd like to ask you, Lipika, and anyone else who wants to chime in, a question that maybe others aren't thinking about or haven't asked. But what do you do for nerves? Because you can practice and you can have the best laid plans, and if you're someone that gets nervous, what do you do when all of that goes out of your head? Or maybe it doesn't. Maybe that doesn't
Oh yeah,
happen.
no, we
What do
all
you
get
do?
nervous. Yeah, I think for me, the thing that has helped the most is what Nilo was saying around practicing my talk. I think people take beta blockers sometimes, and I think those could be very helpful for a lot of people, But I think just in terms of non-pharmacologic things, I'm the most nervous when I haven't had a chance to practice the talk and put things together. And when I have practiced it several times, one story is when we did the phase 1 report of futibatinib, the FGFR inhibitor, my phase 1 director sat me down and he said, Lipika, the company is going to be watching you to see if you can represent them for this molecule. So this is like your first international talk and your first time talking for a company, you have to do a really good job. And it was like a 12-minute talk. And I must have said that presentation like 60 times, like not even with my slides. I just like had memorized every single word, made sure that it was like really streamlined. And I was so nervous. It was like in Barcelona in Spain, and I was like second year attending or third year attending or something. And I think just having practiced it many times. And what we do in our group at Stanford is whenever someone's going up to give a talk for ASCO or ACR or GI ASCO, we have them give that talk in our group among our GI medical oncology faculty. Everybody gives them feedback and everyone asks them questions. I think another thing that I used to be very nervous about was being able to answer questions at the end of my talk. And I think just having that experience of like your group asking you questions, also one, helps you figure out, okay, what are the questions that I need to prepare for? And two, like the nerves that come along with, am I going to be able to answer the questions? It just kind of takes the air out of that balloon a little bit. What do other people do?
Yeah, I think practice is absolutely key. And I also think that giving, so two kind of small tweaks to what Lippy just said, giving the talk to people at least once for the thing you're most nervous about, right? Like if you're doing something that's really important to you or your career, and being able to find someone who's the same kind of audience, right? So like I have given lay talks to my children, for example, like and my husband who is not medical, and I've been like, and so depending on who the audience is, I think doing that can be very helpful. And then honestly, I like to have a familiar face in the audience. And so this is a really nice time to like grab a friend and say, Lippy, will you please be in the audience? And then I can talk at you. And it gives me just like, having that one person in the audience who's nodding when you're talking is so helpful. It could be anybody, but like because sometimes there'll be people that are asleep and you're like, oh my God, I must be so boring. But then there's like the people that just are nodding, and your friends kind of have to nod, right? They have to listen and nod. And so, but I think to me also finding a friendly face in the audience helps calm me during the entire time. And you usually can find that person or people very early, and then you can give your talk and it just kind of calms you down a little bit. So those are some of my techniques.
Yeah, the other thing I was just going to add is don't think that people are not nervous. People are surprised. So I get very nervous before my presentations. It probably doesn't come across because I mask it. I barely eat before I'm going to give a presentation, and people are surprised. So everybody gets nervous, and it's just normal. So part of that also means that you get a little bit of adrenaline, which helps you through the presentation. But don't buy into the fact that people aren't nervous. I think most people are, and I think it's just part of that normal having to get up in front of your peers. And the only other thing I would add is that when I was going to give the ABCO2 presentation at ASCO, big audience or whatever, I was so super nervous for all the reasons you were saying around being able to answer the questions and getting tripped up and so I sought out the discussant just to have a conversation. It happened to be Michel Defer from France, and once I'd spoken to the discussant and I knew what his take on the study was, I was much more relaxed. So sometimes you can do things, speaking to the chair or speaking to whoever's going to do your session can just sometimes help also to alleviate some of the anxieties that you have.
That's a great point. And Juan, I was a discussant for a talk, and I was really nervous about my take on the talk because it was like a gastric cancer study, which is not my area per se. And so I spoke to the I spoke to the Juan of that talk to be like, hey, this is what I'm thinking of saying. And he gave me all these insights that I wasn't even aware of. He's like, this is what we were worried about with the data, but and so I think if you're a discussant too, talking to the primary people who are presenting the data can also be really helpful. I also want to just also really highlight something Gada said in the very beginning, which is that when I gave my first talk, I was relatively monotone. This is a really, really important thing with talks, in that if you want people to pay attention to you and if you want people to really engage and not be looking at your phone, this combination of what Nilo said around bringing the right energy and two, varying your tone goes a really long way in people engaging with you. And also what Juan said about like heralding your next slide, I very often will open slides with a question because that is a great way to engage people's minds. But having excitement about certain things they're sharing on the slide and like using pauses very deliberately can really help people engage in the storytelling aspect of your talk. So Gada, Nilo, and Juan, thank you for bringing up those points because I think that's a really important way to engage.
Well, we are right at the top of the hour, so I want to be respectful of everyone's time. I want to thank Dr. Goyal so much for her time, for her expertise, for her comments. We really appreciate you spending your time with us today. It was a wonderful talk. Not unexpected given the topic and who we knew we were choosing, and thank you all to you for joining. Please spread the word. We have multiple topics in this seminar series. Tiffany, remind me which is up next month.
It's actually Juan.
Oh, wow.
And Dr. Javle, so both of us
Dr.
together.
Javle, who are going to be giving us, sharing with us some of their experiences and life lessons as investigators in the cholangiocarcinoma field. So, Dr. Azad, did you want to add anything else? Oh, no, she had to pop off. Okay. All right. Well, thank you all so much for joining and have a great weekend.
Thanks, everyone.
Bye. Thanks, Libby.